Bonjour tout le monde et bienvenue à cette mise à jour sur le COVID-19 au Nouveau-Brunswick. Les porte-paroles aujourd'hui sont le médecin hygiéniste en chef, le docteur Jennifer Russell et l'honorable Dorothy Shepherd, ministre de la Santé. We just have a Okay, stand by everyone.
Check one, check two. Check one, check two, check one, check.
Try one more.
Check one, check two.
Thank you for your patience.
Good afternoon, everyone. Update on COVID-19 in New Brunswick. Speaking on behalf of the province today are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Dorothy Shepherd, Minister of Health. Bon après-midi tout le monde et
Good afternoon and welcome to this update on COVID-19 in New Brunswick. Speaking on behalf of the province today are the province's Chief Medical of Health Officer, Dr. Jennifer Russell, and Minister of Health, Dorothy Shepherd. Dr. Russell.
à toutes et à
Good afternoon, everyone.
everyone. J'ai le triste devoir
I have the triste duty to say another person in New Brunswick passed away following COVID-19. One person aged from 70 to 79 years of age in Zone 4, that is the Edmundston and Grand Falls region, passed away. This comes after the death last Thursday of another person aged from 60 to 69 years of age, equally from Zone 4. I offer my sincere condolences to the families of these people, and I have no doubt that the people of New Brunswick is feeling their pain as well. There were 33 deaths tied to COVID-19 in New Brunswick since the beginning of the pandemic.
and to report that New Brunswick has experienced another death due to COVID-19. An individual aged 70 to 79 in Zone 4, which is the Edmundston Grand Falls area, has passed away. This follows the death on Thursday of another person aged 60 to 69, also in Zone 4. I offer my sincere condolences to the families of these individuals, and I am sure that all of New Brunswick feels the grief that you are now experiencing. We have now seen 33 deaths related to COVID-19 in New Brunswick since the pandemic began. We will mourn with the family and friends of these fellow New Brunswickers and share in their loss and deep sorrow. Les nouveaux variants de la COVID-19 ont changé.
New variants have changed the pandemic. They're extremely contagious and they are transmitted more readily. From now on, public health is going to assume that all positive cases of COVID-19 in New Brunswick are one of the variants that are extremely contagious. Activities are not going to be like we have known over the past year from this pandemic.
COVID-19 have changed the course of this pandemic. They are highly infectious and easily transmissible. The continued rise in cases we have seen over the last week in our province, along with the rising number of hospitalizations, provides stark evidence of this. We must now assume that these new variants are here with us to stay. Going forward, public health will be assuming that all positive COVID-19 cases in New Brunswick are one of the highly infectious variants of concern. This is no longer business as usual, as we have come to experience it over the past year of this pandemic. And I can tell you that the COVID-19 virus is adapting and taking advantage wherever it can. It won't discriminate between young and old. It doesn't care where you live or what you do for a living. Right now, these variants have caught fire across Ontario, Alberta, Saskatchewan, British Columbia. We are now feeling the heat here in New Brunswick. These new cases are straining our healthcare system, particularly in Zone 4, which is the Edmundston Grand Falls region. And these impacts are actually being felt in other zones as well, as transfers are taking place to other zones. But I want to repeat what my colleague Dr. Gordon Dowd told us 2 months ago when we saw our first case of the variant originally identified in the United Kingdom. He said that the spread of these variants can be slowed, but only if everyone strictly adheres to public health guidance and advice. So now, more so than ever, this is what we all must do. Dans la zone 4, nous comptons mettre
In Zone 4, we have 16 confirmed cases of community transmission. These are cases for which we cannot find a tie-in to an confirmed existing infection. Zone 4 has 15 of the 19 new cases of COVID-19 that we're pointing out today. New public exposure sites appear in other regions of the province, and the risk from transmission is higher with the variants. Today, there are equally 2 new cases in Zone 3, that is the Fredericton and St. John River Valley. 1 case in Zone 1, that is the Moncton and Southeast New Brunswick, and 1 case in Zone 2, which includes counties of St. John, Kings, and Charlotte.
We now have as many as 16 confirmed cases of community transmission, cases where we cannot trace the origin of an infection to an existing confirmed case. Zone 4 accounts for 15 of the 19 new cases of COVID-19 we are reporting today. Community transmission prior to the onset of the UK variant arriving was concerning, but community transmission with the UK variant is much, much more concerning. We are seeing new public exposures pop up in other areas of the province as the risk of transmission is higher with the variants. Today, there are also 2 new cases in Zone 3, which is Fredericton and the St. John River Valley, 1 case in Zone 1, which is Moncton and southeastern New Brunswick, and 1 case in Zone 2, which is the St. John, Kings, and Charlotte counties. We must now assume that all of these cases come from one of the variants of concern. But our most pressing concern now is Zone 4, where we must take further measures to reduce the spread of this virus. Today, Public Health recommended to Cabinet that Edmundston and the Upper Madawaska region go under full lockdown effective midnight tonight. Other communities in Zone 4 will not change status at this time. Saint-Léonard, Grand Falls, Drummond, New Denmark, and Four Falls will remain under the red alert level, while the St. Quentin, Kedgwick areas will stay at the yellow alert level. If you live in a lockdown area, it is vital that you stay at home as much as possible. Limit your contacts and go out only for essentials. Aujourd'hui, Santé publique a recommandé au cabinet qu'Edmundston.
Today, we recommend that the Edmundston area be in complete confinement starting from tonight. The other communities in Zone 4 are not going to change the phase at this time. St. Leonard, Grand Falls, Drummond, New Denmark, and Four Falls are always in the red alert phase, while the regions of St. Quentin and Kedgwick are going to remain in yellow. If you live in a sector of lockdown, it is very important that you stay at home as much as possible and that you limit your contacts and you only go out to procure essential goods. And if you do not live in that sector, it's important not to go in that sector, red sector, or the lockdown that is.
For the residents of the Edmundston area, and we are continuing our efforts to get more doses into that area. Vaccination clinics will continue through the lockdown, so if you have made an appointment, please go to it and get vaccinated. Vaccinations will help reduce the severity of the illness and potentially the spread of the virus. We now have 31% of people in this area who are now vaccinated, and we will be making every effort to expand this number in the coming days. Our situation has changed significantly, and our approach to preventing further infections has to change with it. As transmission with these new variants happens rapidly, close contacts of positive cases are most often already infected by the time the case is confirmed. Therefore, the close contacts of those initial close contacts must also self-isolate as soon as they are notified to do so. It is more important than ever that we all follow public health guidance and advice. This means wearing a mask when out in public, maintaining 2 meters of physical distance from others, and staying home from work or school when you don't feel well. And this is true even if you've had 1 or 2 doses of the vaccine. By adhering to public health measures, we will prevent our healthcare system from being overwhelmed. And in Zone 4 right now, it is overwhelmed. Even if you have received 1 or 2 doses of the COVID-19 vaccine, it is vital that you continue to follow public health rules. Even after being vaccinated, you may contract the virus yourself and spread it to others. Some of the people that are hospitalized right now have received 1 or 2 doses of the vaccine. So the vaccine protects against severe illness, and there will be very rare episodes of people needing to require hospitalization. But at this time, again, we know that it does protect for the most part against severe outcomes. We won't be able to see the full impact of vaccines until a large proportion of the population are vaccinated, and that won't happen until mid or late June. Il s'agit d'une période difficile pour nous tous.
It is a difficult period for all of us, and it happens when we are really tired of this pandemic, and individually and as a society as well. But our best hope is to limit the impact of this new wave of COVID-19 resides in our actions.
Must travel for work or otherwise, please, despite being vaccinated, continue to observe public health measures, avoid gatherings, and keep your contacts low. We must continue to look after ourselves, and we must look after each other. We must apply all that we have learned over the past year to get through this new challenge. And I did hear somebody say earlier today in some of the discussions, we've been having meetings and discussions pretty much all day with various groups, and somebody said, you know, we can't keep doing what we have already been doing. We need to do more. So this is not the time to let our guard down. It is not the time to become complacent. If we all do what we need to do, then we can get through this. Thank you very much.
Good afternoon. Bonjour. Today, there has been another death in Zone 4, the Edmundston region, a person who was 70 to 79 years of age. Just yesterday, we learned an individual who was 60 to 69 passed away in Zone 4. Each person who loses their life to this virus is a tragedy, and my thoughts and prayers are with the loved ones of these two people. I send my sincere condolences to their family and friends during this difficult time. Over the past 2 weeks, people living in the red level area of Zone 4, the Edmundston region, have been working hard to slow the spread of COVID-19. Unfortunately, it has become apparent that we are dealing with variants. And as we have seen in other jurisdictions, we will need to take stronger measures to get this outbreak under control. Cabinet and the All-Party Cabinet Committee on COVID-19 have accepted the recommendation of Public Health to move Edmundston and the Upper Madawaska region into lockdown at midnight tonight. For now, the communities of St. Leonard, Grand Falls, Drummond, New Denmark, and Four Falls will remain in the red level, while Saint-Quentin and Keswick will remain in the yellow level. We will continue to assess the situation over the days ahead and will determine whether any future measures are needed in other communities. In addition, full-time in-person learning for all high schools in the province will now be delayed. We are taking this measure out of an abundance of caution to allow us more time to conduct contact tracing and ensure outbreaks, particularly those involving the variants, are under control. That decision will be revisited the week of April 26th. As a reminder to those in the Edmundston and Upper Madawaska area, under lockdown, people must spend time only with their single household bubble, which may be extended to include a caregiver, a family member who needs support, or one other person who needs support. Schools in the lockdown area will move to online learning only. No informal or formal gatherings are permitted. People should remain inside as much as possible and should only leave for essential reasons, such as work and post-secondary education, if they cannot be done virtually. Health services and necessities of life, providing care for someone in your single household bubble, or childcare and custody arrangements. Groomed, managed trails for ATV or snowmobiles will be closed. Public-facing stores that provide necessities such as food, fuel, and medication are only permitted to sell essential items in stores or through curbside pickup. Non-essential goods may only be sold online or by phone for contactless delivery. A full list of businesses that are permitted to remain open during lockdown is available by visiting the Government of New Brunswick's COVID-19 website and clicking on Alert Levels. During the lockdown period, evictions will not be permitted. Landlords must wait until at least 10 days after the lockdown has ended to proceed with an eviction. Non-essential travel between the lockdown area and other areas is not permitted. I understand that going into lockdown will be incredibly difficult for residents of the impacted area. But this is what we must do to get the situation under control. In recent days, more people have been admitted to the hospital and more people have been admitted to the ICU than ever before in New Brunswick throughout this pandemic. We are not taking this action lightly. We are doing what is necessary to save lives. Now more than ever, we all have to take measures to protect ourselves and those around us. As Dr. Russell explained, we have seen evidence in community transmission in the Edmundston region, and that is something that could easily happen anywhere else in this province. We are also concerned about cases in Zone 2, the St. John region, and in Zone 3, the Fredericton region, and we will be monitoring those zones closely in the days to come. I'm going to go off script here and just add, we talked earlier in the pandemic about our neighbor's house being on fire and what we have to do to protect our own house. And so please understand that it is imperative that you be part of the solution. And I thank every single New Brunswicker for taking this seriously. I know so many of you are. But this is a time for us to be strong and to understand that there are many things out of our control. So we must do what is in our control. We are administering vaccines as quickly as possible, which will play an important role in controlling COVID-19. But for now, even those who have been vaccinated must continue to follow the public health rules to keep the rest of us safe. The next few weeks will be challenging. We have made it this far through the pandemic by working together and doing our best to protect the people around us. The variants have added an unexpected obstacle, but I'm confident that we can overcome it. We must all remain vigilant. Those of us in yellow levels need to continue to limit our contacts and spend time only with those in our steady 15. People who are in lockdown or the red level must stay within their single household bubble. We must all maintain a safe physical distance from others, wear a mask as required based on our alert level, and get tested if we have any symptoms. By continuing to follow public health guidelines, we can reduce cases and we can prevent serious illness and deaths. We can also help ensure the entire province returns to the yellow level as quickly as possible. Let's continue to do our part. Thank you. Merci.
And each reporter will have one question and a follow-up question. Make sure to mute your mics or unmute your mics if you want to speak.
For members of the media, each reporter will have a question and a follow-up question. You have the right to pose your question in the official language of your choice. Please ensure your microphones are placed on mute. Alexander Silberman, CBC.
A question for Dr. Russell. How many of the positive cases are people who've been fully vaccinated against COVID-19?
I had that data for the hospitalized cases, but I don't have it for the total number of cases at this time, but I can look for it because I know for sure in some of the long-term care facilities or adult residential facilities, we do have that number. But again, with the ones that were hospitalized, there were 3 that had been vaccinated, but I think only one of them had been fully vaccinated with 2 doses and was 14 to 21 days post that. And the other 2 had only been partially vaccinated, meaning they had 1 dose each, but it wasn't a full 14 days after that dose.
Silberman, do you have a follow-up today?
Yes, I have a follow-up for Dr. Russell. You spoke a lot today about variants. Could you tell us which variants have been identified in the province?
Most of those cases are the UK variant. And so that's the B117. Right now, we have presumptive results from our lab here at the Georges Dumont, but because we haven't been able to completely confirm them, because again, we have to send them to the National Microbiology Laboratory, we won't be able to get results back for several more days.
Brown, CTV.
Hi there, Minister. I'm wondering if you can walk us through a little bit more of what went into the decision for delaying full-time in-person learning for all New Brunswick, not just the lockdown area.
So this is about trying to bring stability to our high schools and to our educators and planning, really. So for now, we know that as I said in my speech, we have some concerns about the cases in St. John and which is Zone 2, and in the Moncton Region, Zone 1. And so until we are quite confident that we're not going to have more spread from those, again, we have presumptive variants. And unfortunately, they spread so fast. We just want to ensure that we're able to keep distancing within our high schools right now. Because when we go back to full-time high school, while students will be masked full-time and they'll be certainly following as much protocol as they can, it will be pretty much impossible to maintain social distancing. So we need to be quite confident that we're not going to be contributing to the problem. And so this gives us time to watch those, watch the cases. And if we don't have more cases, then we can have more confidence going back.
Follow-up?
I'm just wondering if either of you can tell us if any more patients have been transported from the Edmonton region to other regions, including Fredericton. From what we understood yesterday, there had just been 2.
And
Thank you.
Canada.
Oui, bonjour.
Yes, good afternoon. You can hear me? Yes. Question is for Dr. Russell and their parents and represent from the town of Edmundston, asking why haven't wait to close the schools? So why wait before the lockdown to close the schools? It's always a balance between the risks and the operational plan in red phase, and other phases as well. If a case is tied to a school, the school is going to be closed for 3 days to contact tracing and others operational issues. So at this time, at the present time, the danger for Zone 4, because of the number of cases that continue to increase and the community transmission as well that exists at the present time. That is why we made the decision today to make the recommendation to put them in lockdown, and that was something that was decided with the COVID-19 cabinet and the cabinet as well. Madam Arsenault? Do you have more details on cases in the schools that were pointed out? In Zone 4, I have no other information at the present time on the cases tied to the schools. City, Brunswick News.
My question is for Dr. Russell. I was just wondering with the 2 deaths in Zone 4, if either of those had been fully vaccinated and if the had tested positive for the UK variant.
My understanding, again, is the majority of cases are the UK variant, the B117 variant in Zone 4 at the moment. I don't know if the people who have passed away, if they were vaccinated or not. I just was aware of the total number of hospitalized patients that had either 1 or 2 doses of the vaccine and how long it had been from the time that they were vaccinated to the time that they became COVID positive.
Ms. Seeley, do you have a follow-up?
Yes, I do, and it's also for Dr. Russell. I was wondering if the most recent developments in Zone 4 will come into play with the delaying of the Atlantic bubble, the reopening of the Atlantic bubble.
Sarah, I'll take that one. So, as always, we have been, the Premier has been in touch with his counterparts and the other premiers in the other provinces. They are planning. I know that public health and our departments are working with our counterparts in Nova Scotia, PEI, and Newfoundland. And so I think there are still, some policies that we want to make sure we're fully aligned on. And so for now, we're progressing towards that. But as you can see, the situation in our province right now is very fluid. We take the responsibility that, very seriously, that we are at Nova Scotia and PEI's front. And so we will have those conversations with them and make those decisions together.
Thank you, Ms. Seeley. Before I go to Gary Moore, Dr. Russell has something to add.
So we were made aware of some public exposures. So I'm just going to comment on a few of those, and they are in St. John. So Service New-Brunswick in St. John, the one at 15 King Square North on Thursday, April 8th between 1:15 p.m. and 2 p.m. McAllister Place, 515 Westmoreland Road on Friday between 5 p.m. and 6 p.m. and Thursday, April 8th between 12 p.m. and 1 p.m. So these are public exposures where we know that somebody who was positive for COVID-19 and contagious attended these public spaces at those times. They will be in our press release as well, so you'll have that information. And I guess the other thing, the deaths in Zone 4, again, are very sad, and we do all grieve with Zone 4 right now. But I think the fact that, number one, we did see a younger person pass away, the youngest person that we have seen yet. And I think that hits hard for a lot of people at an emotional level, for many, many reasons, obviously. And we have been able to really spare New Brunswickers from having to deal with too many people passing away from COVID up until now. This variant is not going to be kind to us, and we have seen this happen in other jurisdictions, and my colleagues in Saskatchewan, Alberta, British Columbia, Ontario, Quebec, they have been dealing with many, 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 many more deaths. And again, because the variants are hitting younger populations for two reasons. One, it's just a more aggressive virus, and two, the older populations are getting vaccinated, so they're protected right now. So this is a very, very vulnerable time in the pandemic right now, whereby we're getting groups of people vaccinated. It's not fast enough to stay ahead of the variant at this time, and that's why we do need the public's support and cooperation after the year that we've been through. To ask you to do more and dig deep and even do more than we have been doing, I know is a huge ask, but so much is at stake right now. The stakes are much higher. I was reading reports out of Saskatchewan today about people having to bring children into the ICU to say goodbye to their parents, and that's what's happening in Regina. And Regina might seem far away, but really the surge in cases there have been as a result of the UK variant, and it is quite devastating.
CBC.
Thank you, Bruce. Dr. Russell, I'm just wondering, you said vaccines in Zone 4 are certainly a priority right now. I'm wondering if there'll be any changes to the vaccine rollout in that region right now, given the situation.
Well, we definitely have adjusted our vaccine rollout to send extra doses to that area. The last time we did a press conference, at that time there were about 3,200 extra doses that had been reallocated to that zone. And in the meantime, since then, we now have vaccine clinics scheduled for Zone 4, April 15th, 16th, and 30th in Grand Falls, Saint-Jacques, and Saint-Quentin, respectively. So that's a total of 1,000 doses for all those clinics. And there are Pfizer clinics scheduled in Grand Falls, April 10th, April 12th, April 19th, and April 26th. So, some of those are already fully booked, but the April 19th one in Grand Falls still has spots, and the April 26th, it's not open for booking yet, but will be. So more doses will be going into the arms of people in that zone. And in Saint-Jacques, April 17th, April 19th, and Saint-Quentin, April 13th and April 24th. For the April 19th in Saint-Jacques, that is reserved for the high school outbreak management plan at this point in time, and the April 17th at Saint-Jacques is, some are already booked and some are reserved for the high school outbreak management plan. And there are 13 pharmacies that are sharing 780 Moderna doses this coming week, and that will be repeated again the following week. Now, again, this is a really complicated rollout due to the fact there are so many there are several vaccines that we're dealing with right now, and the transportation and refrigeration issues are very challenging. And also the challenging piece around the delays that we can't control. So one of the Moderna shipments was just delayed by a week. We expect there to always be changes that we have to adapt to, but for the most part, I think we're all running as fast as we can. There's not really more of a delay from the longest amount of time that it takes to get from having a vaccine shipment delivered to it getting into people's arms is no longer than 1 week. So that's a really fast turnaround time that we're very happy about and very proud of all the work that we've been able to do up until now. I do ask for people to continue to have patience around the rollout as there will still always be some challenges. It's not like a regular flu vaccine rollout in the sense that there's only a couple of products and it's a very organized and planned in terms of the certainty of the doses arriving in those shipments and the fact that they can be kept for longer periods of time and we can hold on to them and dole them out as need be. We don't have that kind of control in this particular vaccine rollout plan.
Moore, do you have a follow-up?
I do, and it's for Dr. Russell again. I'm wondering what you can tell us about the suspected variant that's involved with exposure at the St. John Church.
Sorry, you wanted to know if it was a variant?
Yeah, the suspected variant that's involved at the exposure with the St. John Church.
Yeah, I don't have any more information other than it's at NML, and we do expect to have those results back in the next few days. It takes a week. Once we send them to the National Microbiology Laboratory, it takes a week for that turnaround.
Thank you, Mr. Moore. Vicki Hogarth, CHCO.
And I'll just add that it is a presumptive variant. Sorry, I just can't say which one because we have to get confirmation from the NML, but there are 200 people self-isolating right now as a result of those exposures at the church.
Thanks, Bruce. My question is for Dr. Russell. A couple of weeks ago, you mentioned that contract tracers had noticed that the new variant has recently been spreading in places where food is consumed. Have any servers contracted the virus while on the job? And if so, should we be taking more precautions in yellow zones, such as ordering food with masks on?
That's a really great question, Vicki, and I don't have data specifically on that. I would have to ask some of the regional staff around the cases and the contact tracing in terms of servers. I know that there has been transmission in restaurants among staff, but I don't know if that happened between staff and patrons or patrons to staff. So I can find that out from my regional staff, but at this time I don't have information on that, again, other than the transmission that I was aware of happened between staff. But definitely, the more cautious that people can be right now with these variants, the better.
Thank you, Doctor. Ms. Hogarth, do you have a follow-up?
I do. It's also for Dr. Russell. The person who contracted the virus, who had had both doses of the vaccine, had 14 days passed since the second dose, and were they exposed to the new variant? And did they have symptoms? And I guess I'm asking ultimately, do the vaccines seem to be as effective against variants?
The data that we have from across the world and here in Canada is that once you get a certain amount of the population vaccinated, you do see a population level decrease in cases in those populations that have been vaccinated, no question. Will there be breakthrough cases? Yes, there will be. We do expect there to be. And that's why we need everybody who's had 1 dose or 2 doses of any of the vaccines to continue to follow public health measures.
Thank you, Ms. Hogarth. David Caron ou Alison Roy, l'Acadie Nouvelle?
L'Acadie Nouvelle.
That concludes.
Voilà qui m'a fait la mise à jour d'aujourd'hui. Merci.
Merci beaucoup.